Well, fantastic. We're going to go on to our next presentation. Thank you very much, Rebecca. Our next presenter is Scott Hutchins, and he is from the Michigan Department of Education. He is a school mental health and Medicaid consultant in the Office of Health and Nutrition Services. Scott is a lifelong learner dedicated to servant leadership with a master's degree in educational leadership from Eastern Michigan and a bachelor's degree from Michigan State in elementary education. Prior to coming to MDE, he served as a public school teacher and administrator for 20 years. Scott is passionate about being a champion for all learners and is committed to being better than he was the day before. Scott, turning it over to you.
Thank you very much, Sarah, and thank you to all of you that have worked so hard to put this summit together. It's been a great experience working with all of you, facilitating and presenting, and it's an honor to be here. So with that, I will go ahead. Can someone give me a verbal that they can see this okay?
Yes.
All right, thank you. I appreciate that. So as Sarah said, I am Scott Hutchins. I am a school mental health and Medicaid consultant. I have the pleasure of talking to you today about the BHWorks platform. But before that, I do want to give a little bit of a historical context on what got us here to this point. So I've titled my presentation, Strengthening Our Reach Together to Support Student Mental Health. And I feel that the visual here on the right-hand side really does a great job of really talking about what we're here to do today to do. We've got amazing presenters that have spoken to this point, and they're looking at the chat box and seeing the questions that are generated from the nearly 200 plus people that are here. It's just exciting to see how we're all starting to come together and really put our hands on children collectively and look at what is the best way to address mental health. Again, if you look at the chat box and you look at the questions and you listen to the presenters, you can see that there are several initiatives and several ideas that are very solid, very vetted, research behind it. So one of the challenges is trying to figure out which of these practices are going to be best for each situation. So we are fortunate that we do have legislative funding that provides direct mental health services for children in school. If you're not familiar with this section of the State School Aid Act, it is known as Section 31N. Many of you may be familiar with 31A, which is at-risk funding, but 31N was started nearly 4 years ago. And again, that's specifically for providing direct mental health services for children in school. The first fiscal year that it was allocated was 2019-2020 school year. And as you can see, $30 million was allocated for that first year for hiring direct mental health services. The second year, 2021, again, $30 million. And then this year's allocation, which is the 2021 school year, it started at $36 million. But then in March, a supplemental budget was passed by the legislation to increase that funding to over $56 million, equally divided amongst all 56 ISDs. What this funding can be used for is hiring qualified, certified mental health providers in schools. So master's level social workers, for example, school psychologists. The reason there is a requirement that they have to be master's level is because part of the legislation requires them to also bill Medicaid for eligible services. That does not mean that those services can only be for students that have Medicaid. What that means is if a student happens to have Medicaid, that licensed provider is required to bill Medicaid. And the reason for that is the intent is that this legislation, this funding will start producing money for schools, for ISDs, for local districts to hire social workers. But eventually, if that budget either plateaus or for some reason has to be reduced down the road for other budgetary reasons, that Medicaid reimbursement that districts are receiving through their Medicaid eligible student services will be able to supplement that money so that you're not having to begin a behavioral health program and 5 years from now turning around and having to lay people off. So that's one of the great things about this legislation is not only is there an initial significant contribution through the State School Aid Act to get that money into schools, but then there's also that component of the Medicaid billing, which allows that funding to be sustainable. And as we all know, and as we've heard throughout this presentations from several of you today, we know that this is a need that is not going away. Mental health, behavioral health, physical health are all critical components of the whole child, as we've heard several times, the importance of all of this on the student impact and on their learning. So again, these needs are not going to be going away anytime soon, if ever. And so the fact that we not only have a significant amount of money in the State School Aid Act, but then also that piece with that Medicaid contribution, or excuse me, Medicaid billing, which allows funding to come back to the schools to sustain that, is critical. As you can see in this slide, as of last year, there were over 165 full-time equivalent hired mental health providers that served 300 districts and 750 buildings. And over 330,000 of our 1.5 million students in Michigan attended the school with a 31 unfunded provider. Those numbers are going up. Again, that is as of last year. This year, we currently believe that there are close to 250 behavioral health providers that have been able to serve students in our Michigan schools because of this funding. In addition to that, another extension of 31N is also 31N Section 5, which is known as Expanding Enhancing Emotional Health, or more commonly known as E3. So not only did the budget or the legislators approve a budget that allowed school districts and ISDs to hire behavioral health providers, they also allocated funds to child and adolescent health centers that were in existence to, again, following that same format of hiring licensed master's level behavioral health providers, so that all child and adolescent health centers could apply to also add a behavioral health provider to provide student services. The other thing before I get into BH Works that I wanted to remind people, there's been a lot of conversations and a lot of great ideas generated. If you think about the school nurse model that Terry and her team shared, or in the chat as Judy talked about the importance of school counselors. If you want to look at the impact that we just heard about, there is lots of dollars that are available through the Education Equity Fund. That are available to school districts in Michigan. They can compete for additional federal funding. The two main focuses of the Education Equity Fund are narrowing the digital divide and providing mental health services and supports. And as you can see, over almost $7.7 million in grant awards are available. So that's, again, if you saw something today that struck you and had an impact on you, you could definitely bring that back to your team and consider an Education Equity Fund grant. So with that, that brings us into BH Works, something I'm very excited and passionate about that we've been able to bring to all 56 ISDs. So through a collaboration from MDE and DHHS, BH Works, which is powered by MD Logics, is available to all 56 intermediate school districts in the state of Michigan. What is BH Works? So BH Works is a HIPAA and FERPA compliant tool that allows providers and school districts to do everything from managing referrals and consent to student screeners and assessments, which I'll get into in just a little bit about what that looks like, care management and care coordination, conducting virtual visits. So I know that I was pleased to hear from one of the representatives on that panel first thing this morning, talking about the importance of telehealth and how many people have found a great deal of comfort in being able to speak with a provider in comfort of their own home. BH Works has a telehealth component in that. So again, glad to hear that the representatives and the senators or legislators are supporting the continuance of telehealth. And then tracking outcomes and data dashboards. This is critical when we talk about looking at identifying areas of need throughout the state of Michigan. I think everybody on this call understands the reason that we're all here is because we want to save lives and we're passionate about mental health and reducing suicide and hopefully eliminating suicide. But we need data to be able to back that up so that when we're as a state, we're applying for federal funds or we're trying to allocate, there's a great deal of ESSER funds and COVID related funds that are being distributed throughout our country. We want to be responsible with that money. We don't want to find a hoverboard that has been SEL endorsed. That would be silly. Or a playground slide that has a phrase that says, well, do SEL, that's the next best thing. Of course, I'm being facetious, but that is what's happening. A lot of vendors are clamoring for all these funds. So we want to be responsible stewards of this money. And BH Works will allow us to collect important data on what our students are being referred for. What types of treatment services are they being treated for? So do we have a high rate of suicide ideation or anxiety, or depression, or substance use disorder? With our providers that are going to voluntarily use BH Works, we're going to be able to look at that data and again, be able to make informed decisions so that we can be good stewards of that money and use it for the right reasons. As you can see down the bottom of this slide, BH Works is validated in diverse settings. So not just schools, hospital emergency departments, primary care, federally qualified health centers, community-based organizations, schools and universities, of course, mobile crisis teams, and workplaces. So next I want to talk about is the impact that BH Works can have on ISDs and local districts and behavioral health providers that use it. BH Works allows providers to do all of the following: enter and receive referrals, screen, assess, provide services virtually, maintain records, exchange secure information, care coordination, such as plan of care development, consent forms, monitoring progress goals on those plans of care, billing integration, obtaining real-time data, and recording student interactions for reporting. All of this is available within the BH Works platform. So when we look at what is our vision for the state of Michigan and the use of BH Works, we are fortunate enough to be able to bring together a group of professionals from across the state, from multiple ISDs, folks from the Department of Education, Department of Health and Human Services, and of course our partners, MD Logics, who own BH Works, to bring together a steering committee to help us to look at what is this going to look like as a statewide deployment. The steering committee members have been leaders in this project and really helped us develop standard operating procedures and help us to figure out how we're going to roll this out, because we've got nearly 1.5 million students in Michigan. We have 56 ISDs. As I mentioned before, we're close to 250 providers that are just funded with 31N. That's not to mention all of our other social workers and school psychologists and other behavioral health providers that are already funded through general funds in schools. So looking at a platform for an entire state is a huge undertaking. And so a steering committee was brought together to really, again, help us identify standard operating procedures and what are the basic elements of BH Works that we want to be able to roll out to all ISDs. If this is new to you, which I'm guessing it probably is to a lot of you, that's not a surprise. We are in a position where, again, the funding from 31N section of the State School Aid Act goes directly to ISDs, and then the ISDs are responsible for determining how that money gets disseminated within their ISDs. Some of them equally allocated the money to their local districts. Other ones, such as where Terry's from in Wayne Risa, that equal allocation of nearly $500,000 in Wayne Risa is nothing compared to what $500,000 means to the Eastern Upper Peninsula or Copper Country or some of our other friends in the Upper Peninsula. So there's an equal allocation, but again, that presents its own challenges because ISDs some are large, some are small. I like to think of it as the Goldilocks and the Three Bears. For some, that $500,000 is just right. For Wayne Risa, it's not nearly enough. For Copper Country, it's more than enough. So, but again, taking this back to what BH Works, so if you haven't heard of it, it's because, again, our focus has been to reach directly to our contacts at the ISD level and work through them to help us determine what is the best way to support their individual ISDs and all of their local districts. So if it's something that, again, you're hearing about and you're passionate about for the first time today, you can reach out to me through email, and I can help explain to you the process of what we can do to possibly get BH Works into your local district. But again, It's going to start through the ISD level because that is where the funding primarily has been funneled through, or excuse me, not primarily, but has been funneled through during the 4 years. So again, if it's something that you're passionate about or interested in, reach out to me and I can help explain the process in terms of rolling that out through the ISDs. Lastly, I'll just add before I go to the next slide, the steering committee, again, their goal is to work on vision, strategic planning, scaling up, and sustainability. The team is comprised, as I mentioned before, lead staff from the Department of Education, Department of Health and Human Services, our partnering ISDs, and MD Logics. Our vision for the statewide deployment of BH Works is much bigger than just looking at what impact we can have in the local school districts and the ISDs. Again, thinking back to all of our amazing presenters today, if you think of what Leah mentioned in terms from the Pediatrics Association, and some of our other presenters, again, have talked about all of this coming together. We need to work together as a system to really impact the state of Michigan and our students, and then, when they become adults. So with BH Works, again, the goal is to start with the ISDs. We needed to start somewhere. Unfortunately, the 31N of the State School Aid Act has enough money in there to provide this at no cost to ISDs. Again, that's MDE and DHHS allocated funding that we are providing this to the ISDs. But again, it's hopefully going to be a launching pad for a much bigger initiative down the road where we look at a comprehensive statewide system designed with multiple perspectives, views, and users in mind. So it's a student-centered system that involves ISDs, but also our child and adolescent health centers, our state and local governments, our social service agencies, healthcare organizations, all seamlessly working together to identify and support students at risk for behavioral health issues. Again, this is a broader, much bigger goal. Could be 5 years from now, could be 10 years from now, could be less, but again, we needed to start somewhere. And so we're excited that we found funding for ISDs to be able to start using BH Works to help us to start telling the story, help us to start collecting data so that then we can look at the research and use that data to say, you know what, there's a need across the state of Michigan that BH Works can fill. Let's funnel this over to our child and adolescent health centers, our hospitals, et cetera. And again, if you look down at the bottom, MDE is making BH Works available to all 56 ISDs that I mentioned. It provides referral, consent, screening, identifying, assessing, monitoring treatment, and care coordination, all while streamlining that confidential communication with families, school staff, and providers. So when we look at the goals for Michigan ISDs and LEAs that are using BH Works, first thing we want to do is develop that community of practice that will improve the mental health culture in Michigan. That's first and foremost. Simplify the process for providers delivering comprehensive behavioral health services. As Judy Williams mentioned, former president of Michigan School Counselors Association and current professor at Grand Valley, school counselors are being asked to do so many different things. Actually, all administrators, school nurses, school counselors, they're all being stretched. We know that, but again, I wanted to highlight what Judy mentioned. We need to be able to put people in places for them to be successful, to do their jobs well, to do what they're intended to do. And so if they're intended to provide behavioral health services, but they're chasing down consents from parents, or they're a school counselor who has to help with testing coordination, we know those things are critical and we know those things need to be done. But if we can get something in the hands of those professionals to allow them to really do their jobs that they're intended to do and do their job well, that's one of the goals with BH Works. So simplifying the process for providers to deliver those services. Providing standardization with all ISDs electing to use BH Works. I started in this position in February of 2020. And the first thing I did was spend a lot of time listening and asking questions and finding out what are successes of behavioral health programs in schools? What are challenges that people are facing? What are the barriers and things like that? And one thing that I heard over and over again was, Scott, are we doing this right? They just wanted the affirmation, like, we think we're doing this, but we don't really know. And that really told me a lot, and really was why I wanted to find something that, again, could provide standardization, because I don't want ISDs and local districts and providers second guessing or wondering if they're doing it right. I want them to be able to follow the intent of the legislation and provide services to students and feel good about their doing that. And BH Works is going to help us with that. Improving mental health outcomes. Again, that's what we're here for today, right? That's what this whole summit is intended to do. It also improves confidential communication with families, school staff, and providers, and implementing mental health screenings for all students. If you think back to the beginning of fall, when the Myers returned to school, or the roadmap, excuse me, from Governor Whitmer, returning to school roadmap came out from Governor Whitmer. One of the things that she recommended was universal screening for all students. If you also look at the My Blueprint that came out in spring, that also recommended screenings for all students. And one of our work groups will actually share some information on that in just a little bit. But BH Works is a tool that would allow schools to be able to do those universal screenings. Vetted resources, they have over 150 screeners within their inventory. As long as there are no copyright or legal ramifications to using the screener, and the screener that's being used currently by a school district can be uploaded right within BH Works. So that brings us to the right side of this slide in that pyramid that you see. So at the bottom, again, it starts somewhere. How do we identify students that are in crisis? If we're fortunate enough to have a student ask for help, then again, we're going to be able to deliver those services if we have the capacity to do that. Or if a teacher or administrator makes a referral, again, those are the students that we know need help because they've either asked for it, they've received a referral. But what about our silent students that are in crisis? What do we do for them? That's where a tool like BH Works can come in, because again, we can use those universal screeners and identify those students who aren't outwardly displaying signs of behavior or haven't received a referral from someone, but they're in crisis and they need help. The next piece of that pyramid is the assessment. So once we've identified that there may be a child that's in crisis, now that behavioral health provider can do that assessment individually with that child, get feedback from parents, teachers, caregivers, etc., and make a determination on if they're going to start to deliver services, the next piece of the pyramid. Once that service delivery begins, now is that critical component part of that ongoing monitoring, that continuous improvement, making sure that that child's making progress towards their goals, but not just individual progress towards goals, but we also want to look at system-wide monitoring, systems improvement, because again, using that data that's going to be available within BH Works is going to allow us to, as I mentioned before, identify what students are being referred for, help us make determination on are the treatments that are being administered being successful, looking at that de-identified data to find out if we have large percentages of students suffering from certain things such as suicide ideation or substance use disorder. So all of that, again, is available within the BH Works platform. So I want to touch briefly on the universal screening piece that I mentioned. So with BH Works, there is a web-based and security compliant platform that would provide a single system to screen whole student populations, where students can easily enter responses on any device with an internet connection. So a link or QR code goes to that child. If they're on a tablet, smartphone, laptop, etc., they can immediately respond to the screening. Or if it's a younger child, let's say kindergarten through 6th grade, that QR code or that link can go to the parent instead, the caregiver, and they can provide the input. And then those results are immediately configured directly in BH Works, and then a report is sent to the provider. So again, they can immediately identify and assess what the needs are for that student. The other thing that BH Works does with the universal screening piece is it minimizes that paperwork, so it allows staff to spend more time working directly with students, as I mentioned before. So here's what it looks like with that web-based screening. So again, the student self-reports, or a parent or caregiver on behalf of the student completes the screener. That risk is immediately scored and summarized. And as you can see on the right, this is an example of a report that again would go back to the provider. And again, as you can see, would identify hotspots or triggers, things that we need to be aware of, red flags, etc., on what that student's flagged for during that screening process. Additional benefits of BH Works, efficiency and time savings to staff. Again, we're talking about streamlining documentation, looking at the accessibility and flexibility, reducing errors, the systems integration with student and billing. Once we have full integration with the student information systems such as PowerSchool or Skyward, we can, again, pull that information into the BH Works platform so that providers aren't having to manually enter first name, last name, birth date, address, etc. And then the billing component, again, once the integration takes place, all those services that providers are providing directly to students at the end of the month can be summarized, and a statement can be sent to your billing company, such as Illuminate, PCG, whatever. And again, you can continue to do that Medicaid billing piece. The statewide standardization is so critical. I mentioned before about the importance of data and reporting. The end of year reporting, all 56 ISDs that receive funding are responsible for reporting numbers to the state of Michigan, so that we can create a legislative report and continue to tell a story and advocate to the legislators of why this funding is so important. And I do want to mention they have been extremely supportive, as you can tell from the first presentation this morning. So they're just passionate about it as the rest of us around this webinar today. So I mentioned the integration piece. Again, the goal is to either be connected with the Michigan Data Hub or individual student information systems. And then the billing component, as I mentioned before, a monthly statement can be sent directly to billing companies that capture all those billable services. As you can see from this next slide, by the end of this school year, we'll have 3 sites already live with BH Works, Lewis Cass, Monroe County, and Copper Country. And then we're really excited about this next slide. As you can see, by fall of next year, nearly 28 of the 56 ISDs and growing have already committed and either had a first kickoff meeting with BH Works or have one scheduled in the next couple of weeks. And again, as you can see, we're covered all across the state, including the Upper Peninsula. And again, this is only going to grow. This was as of, I think, 2 weeks ago that we were able to put this image together, but really excited about the potential. I will clarify that this is not mandatory. We cannot make it mandatory because it would be an unfunded mandate. Even though we are paying for BH Works, we are paying for the platform and its use, but ISDs are still responsible for someone that would obviously have to coordinate that and integrate that system within their ISD. And that's not something that MDE is able to pay for. So the platform itself is being paid for, but those administrative services and costs that are related to helping administer the program, we couldn't cover that. So it is an unfunded, it's not a funded mandate. So therefore it is an option, but we hope that ISDs will elect to use this service. All right, with that, I know that we are getting close to time and I want to make sure to respect Nick and his next presentation regarding the BHLC. So I will stop sharing and see if there are any questions that I can address quickly. Fortunately, what Nick and I are covering together, there can be some layover. So if there's any critical questions, I'm happy to answer those.
There are quite a few questions in the chat, Scott. So I'll go over a couple of them. So at this point, BH Works is interfacing with school ISDs, correct? And in the future, maybe connecting with other agencies like community mental health.
Correct, that's the goal, yes.
Okay. And then somebody had a question about HIPAA and FERPA compliance. Could you describe what that really means?
Yeah, so the data that is entered into BH Works belongs to the ISD. So that data is not viewable by the Michigan Department of Education, even though we are providing the cost for the platform for ISDs to have it. Again, their data is their data, they own it. That data cannot be, it's HIPAA and FERPA compliant because you have a provider that, for example, would be taking care notes. If they choose to use the BH Works platform, they would be the only one that would have access to those care notes. So even an administrator that's able to make a referral into BHWorks would not be able to see an individual provider's care notes. So that's what we mean by HIPAA compliant. And as far as FERPA compliant, that relates to student records. So again, we would be accessing information like demographic information, such as a student's address or birthday, guardian information. That's that FERPA information. But again, that's all protected within the BHWorks platform.
Are schools able to sign up if their ISD is not signed up yet?
Yeah, we will work with you. There'll be some technical difficulties we'll need to work out, but yes, we will figure out a way to, if you have providers that are funded by 31N, we can certainly work with you on that. If they're not funded by 31N, that creates a whole different challenge. But again, reach out to me and we'll see what we can do.
Okay, and then one more. Could you describe the type of screening and assessment tools that are used?
I'm sorry, could I describe the what?
Screening and assessment tools.
Yeah, so as I mentioned before, there's over 150 screeners available currently within the BHWorks platform. I know that Alan Tien, the president of the company, has graciously offered to be here with me, and he just took us off camera, which is great. Alan, do you want to address the question on the screeners?
Yeah, sure. Thank you, Scott. We have, it's probably a little more accurate to think of BHWorks as having a measurement component. So anything that you might want to measure, we can support that. And our current inventory is about 150 assessment or measurement tools. Many are for screening, others are for really more detailed assessment. The core universal screening tool is the BHS, the Behavioral Health Screen. So that is a tool that has been in development and lots of studies and validation papers since 2004, partnered with folks at CHOP in Philadelphia. It covers about 15 of the main domains of behavioral health problems and psychosocial risk factors, primarily self-report for students, but there's also a younger version for primary school kids that parents can fill out. So that's really a core tool that's available.